Hello, TOVA community. This is Dr. Nina back for another TOVA Tuesday, where we talk about all matters related to health and wellness with the intent that we're going to help you live a better quality of life, improve your health and your wellness. I am so excited today because I have a great friend of mine who's also doing such great work around the country in really educating communities about the importance of building a sense of communities. Although we live in a very polarized world today and there's so much tension and dissension, there's actually communities that are actually forging bonds together to fight issues of social justice and matters that are important to me as well as important to our community. So Dr. Tiffany King is a wonderful person who's associate professor at Georgia State University and is actually an author of the book called The Black Shoals. So we'll talk more about it today. But we're going to also bring it back to health and wellness because there's lots of points and lots of principles that Dr. King will share with us to really make us understand that we have to work together and we have to have a sense of community because that really helps us live a healthy life. It really matters. So I want to say welcome to the show, Dr. King. How are you today?
I'm doing well, Dr. Nina and audience. I hope you all are well too. I'm good.
Can you see the screen here, Dr. King?
Yep, I can.
So Dr. King actually graduated from Tower Hill School, and she is the daughter of the track and field legend, Mr. Bob King. And so we were actually competitors in field hockey and track and field and became good friends. So yeah, we worked together, we competed together, but after we competed, we were always good friends. There's times when Tiffany, most of the time she beat me in a lot of the races, but on the field events, you know, we were more competitive. And we also worked at PS Pool together. We've had a lot of great memories. So thank you so much, Tiffany. But you're very accomplished and very modest as well. So I'm going to have to just break it all down because I want our community to know what great work we have from those who grew up in Wilmington, Delaware. So Dr. King graduated from the University of Virginia with a BA in urban planning. She also went globally, got a degree from the University of Toronto, Canada, and an MA in sociology and education. And then received her PhD from the University of Maryland in American Studies. She's very, very active in the community issues of social justice. We will talk more about that. And she's a woman of strong faith and spirituality. Dr. King is the winning author of The Black Shoals, entitled Offshore Formations of Black and Native Studies. Dr. King, I did read your book. It did take me a minute, but I learned a lot, so we will get into great discussion. And Dr. King is the winner of the American Studies Association Laura Romero First Book Prize in 2020. So I want to say welcome, welcome, Dr. King. How are you today?
I'm doing well. I'm doing well. How are you?
I'm great. You know, it's been a very tumultuous year, a year of uncertainty, but we have been able to adjust and embrace this new normal. It's not the way I would love to connect with you, but it does work, and I'm so happy to see you. But, you know, before we get started, I say, Dr. King, yes, you've worked a lot with nonprofits. You're a winning author, but we're going to talk about health, and we're going to talk about historical perspectives of indigenous communities and how that impacted slavery as well. But I want to ask you that I found this statistic that showed that people who have a sense of community have better health than those who feel isolated or marginalized. Can you talk about that?
Yeah, no, that definitely makes sense. In preparing for this, we just thought about the ways that being in community, having, whether that be a family or chosen family or church community or groups that you're with, it gets you out of a space of isolation, right? So you're more likely to have a structured schedule. So to be taking care of yourself, to show up for other people, right? So be eating right, to some extent moving, right? You have some activity. So those also have health benefits, but also people to kind of watch out for you and have some other eyes and notice things that you might not attend to, or you might not be in a space to necessarily pay attention to, and can check in with you and just ask that critical question, how are you, right? So your community can help act as a barometer for your health. So that is deeply important, to be in community, right? And so these longer historical kinds of violences that I paid attention to in my book, like transatlantic slavery and genocide, have been forces that have destroyed communities. And so Indigenous people and Black people have had to work hard to build and strengthen communities. So that is vitally important to both of these communities, and is always connected to their health and well-being, right? That sense of collectivity.
Right. And also, there was another study that I had an opportunity to read. This was a researcher that found that during this pandemic, that people who were more socially isolated and didn't stay connected or at more risk of developing depression. And that can also impact one's physical health. Can you talk about that too?
Yeah, definitely. I mean, and it's been difficult for people, particularly people who live alone, right?
Hmm.
I know I'm in Atlanta, Georgia, and live by myself, right? So I've had to develop a pod, right? Have had intentional kind of happy hours with people, right? Have had
Oh,
like walking dates, have ridden my bike. With some other sisters who also live alone. So you have to be really intentional in this particular moment so you don't succumb to that kind of isolation and depression that stems from it, right?
right. And even both of our parents are seniors. My mother has a cell phone and she knows how to FaceTime, and I'm sure
Yeah.
your mother does as well. So we've been able to connect with our families in different ways, but it's very,
Hmm.
very important for that. But historically, Dr. King, in your book, The Black Shoal, you talk about the shoal and the importance of being able to speak and work in one voice. Can you talk about that? And I have pictures of a shoal and also a school of fish. So can you
Hmm.
explain to the audience what we're talking about?
Yeah, so what I was trying to do, I was trying to bring together communities that are often seen as separate, right? So Indigenous people and Black people, for instance, in movies, never appear on the same screen. Rarely do you see them talking to each other. Rarely do we see them talking about historical alliances, like the alliances that Black people had with the Seminoles, right? So there's a whole
Mhm.
Seminole War to fight both the Spanish and the British, right? First of all, protecting Black folks from slavery, protecting Seminole folks from the encroaching British colonizers, right? So we rarely get to hear those histories, certainly not in school. We don't get to see them in movies. We don't get to see them on screen. So people don't really know about that history. So in the book, I was trying to create a space where those histories could come together. And often if you in my field as an academic, as someone who takes history, literary studies, film, and artwork seriously, that's what I was trained to do as an American Studies scholar. You see how people make meaning of these forms, right? And so for instance, in like a long tradition within Black studies, we have this ocean metaphor. We talk about Black people as emerging from the ocean, emerging from the Middle Passage, right? That great journey across the sea, right? We've seen some of those scenes in things like American Gods, right? We've seen
Mhm.
people in the hold of a ship, right? There are a number of other different movies that I can't even think about now, but we have that story of Black people emerging from the Atlantic Ocean. But we also have this other story of Indigenous people coming from the plains, right? So we think about buffaloes and mountains and plains, but those landscapes often don't come together, right? So in the book, I was like, where's that place where both land that we think of Indigenous people in the ocean, where we think of Black people, comes together? And I found out about this place called the Shoal. Actually, Nina, when I was driving home from work, we have this road called Flat Shoals, right?
Wow.
And I had never really paid attention to it. And as I was writing, I was thinking about maybe the shoreline is the place where land and water meet. But I was like, I really don't like the shoreline because shores often get um, consolidated or incorporated into nation states. And I was trying to get beyond thinking about the nation state. And then I was on Flat Shoals and I was like, what is a shoal? And immediately went home and looked it up. And it was described as the place where, if you're looking at Dr. Nina's screen, that top picture, you see how that sand comes up and like pushes through the surface of the water. So it's another place where like the ocean floor like literally kisses the surface of the water and pushes through, right? So you'd have to leave the shoreline, swim out a little bit to where the ocean floor rises up again, and that's where the shoal is, right? So they're in different places in the ocean. They can be farther out from the shore. They were often in the 19th century places that ships didn't have the technology to necessarily track and could crash into them. But it's another place where land and water meet. So land thinking indigenous people, ocean thinking Black people, it's a meeting space. So I used it as a gathering space to bring together our histories in the book.
Wow. And also, too, in your book, you talk about a school of fish is actually a shoal. And that's also that, when school of fish, they kind of swim together in a synchronized pattern
Mm,
or synchronized movement. And so you really emphasize the importance of collectivism and having that common ground. And so the shoal is a metaphor for that, would you say?
right. Absolutely. Absolutely. And I mean, and what could be a better time for Black and Indigenous people to be talking to one another as we're faced like with these disproportionate numbers of infections and deaths, right, at the hands of COVID. So we're two communities that experience that devastation at escalated rates. And so it would be helpful if we talked about strategies around prevention, around cures, around how do we feel around vaccines, right? What kind of communities of support are we structuring for people so we survive?
Right. It's
Hmm.
important.
Yeah.
So I want to ask you another question. I really want to talk about your book, and I was very intrigued by it because sometimes I didn't realize all of the collective work that is going on the ground
Mm,
because you don't really hear about, these organizations or people working together. But you really talk a lot about in your book, The Black Shoals, you talk about connective bonds that are forged between Black, African American, and Indigenous communities to protect sacred land and create a new world we desire for the next generation. Can you
mhm.
talk about that?
There are some
That's heavy.
projects like,
I mean, in
yeah.
my mind, I think about what kind of world would I want to live in? But there are
Mhm.
people that have been doing this for centuries and historically for a long time that have been doing the work.
Yeah, I mean, there are maroon communities all over South America. Like, so people might be familiar with quilombos, right? These spaces often in the mountains or in the interior, like around Salvador, Brazil, right?
Mm-hmm.
Where fugitive slaves would go and make community with Amerindian people and indigenous people in the Amazons, right? So that happened in the Caribbean. That happened in spaces like North Carolina and Georgia, right? It's been happening ever since the 15th century, right? 1492 that we know of. But there are other kinds of projects like Lifted Voices in Chicago, where particularly Black and Indigenous women get together and talk about survival, right? And are focused particularly on police brutality that
Mm.
Native people and Black people experience. And then there's also a project that I want to learn more about and actually visit. I have a few colleagues who are involved, Allison Guess and Eve Tuck, called the Black Land Project. And they specifically work um, with indigenous people to think about how to reconnect Black people to land here in the Americas, right? Knowing that our original homeland, and even if we want to think about ourselves as indigenous people who are descendants of folks who made that middle passage, like how to reconnect to this land mass when it is not our original homeland. So that work is going on today. right? It's still happening.
Wow. And so when you talk about the importance that the communities, these indigenous communities and Black communities are forging these relationships to protect sacred land and to create this new world. When we talk about building healthy communities, what does that look like?
Um, I don't have as much information about like Lifted Voices that's in Chicago, and also
Mm-hmm,
Black Land Project is New York based.
mm-hmm,
But when I think about, for instance, Sister Song that's in Atlanta, they're a reproductive justice organization. And so I know one of their members, Koya Hope, is I think he's Lakota, is a member of a multiracial organization of women of color. So Monica Simpson is African American, who is the director, but they focus on women of color. So it's not
mm-hmm,
explicitly just indigenous and Black, but
mm-hmm,
it's women of color, right, who
mm-hmm,
disproportionately experience the kinds of health disparities like maternal, what is it, maternal mortality and infant
mm-hmm,
mortality,
mm-hmm,
right, at higher
mm-hmm.
rates, particularly
Right.
with white women. So they're a part of a disability justice movement. And
Mm-hmm,
so what reproductive justice looks like to them is certainly issues like abortion and access to abortion, but it's also things like making sure that the police don't kill our children,
mm-hmm,
right? Particularly for Latinx and Black and Indigenous women. That's a part of reproductive justice, right? So it's
mm-hmm,
also a part of community building, making sure that people in our community are not as susceptible to death, right? So
mm-hmm,
they're also, some of their work was a part of the work of like defunding the police, right?
mm-hmm,
And putting more resources into reproductive justice and health. So
mm-hmm,
that's work to sustain communities that links Black and Indigenous people too. That's work that's
mm-hmm,
going on in Atlanta that I know about.
mm-hmm.
Mhm.
So, I'm a healthcare provider and advocate for sickle cell and other kinds of medical conditions that affect the Black community, such as heart disease and diabetes and higher rates of obesity, but
Mhm.
also those who have suffered from depression and other mental health disorders. So, there's so many issues when we talk about health disparities that are also related to social justice issues that really are impacting our communities. And when we think about health, we sometimes don't think about all of the other external factors that affects one's health and wellness, not necessarily me as a provider seeing the patient, but if my
Mhm.
clients don't have access to clean water, or if they don't have access to affordable housing where their rent doesn't constantly skyrocket when wages have been stagnated since the 1970s, that this huge inequity in pay, those also impact one's health. Would you say
Mhm.
that too?
No, absolutely. You hit it right on the nose. Like the work that's going on around Flint, Michigan, what folks were doing at Standing Rock. You saw the Standing Rock
Mm-hmm.
Sioux trying to get that pipeline, the Dakota Access Pipeline, from running through their communities, right? It was rerouted to run through Native communities and not white communities, right? So those kind of environmental degradations and that kind of ecocide has a direct impact on Indigenous people's health, has a direct impact on Black people's health in Flint, right? And you know that those particular diseases, well, I'm gonna let you speak on what water does to people's babies.
Oh, their lead levels
Yeah,
because
I'm
their
not gonna
pipes are
dabble
old
in that,
and haven't been
but right.
replaced, right? Go ahead.
Hmm. Exactly. No, 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 exactly. Those are the kinds of things that have health impacts, right? It's not just about racism and inequities or in access to water or infrastructure. That's about health, right?
Right.
It's about health.
Exactly.
And then also, like, if you're not able to access water and clean yourself in a particular way right now during COVID, your numbers are going to spike. Your community's numbers are going to spike, right? If
Mm-hmm.
you have to go out and constantly find water that's not available in your home, you're
Mm,
exposing yourself to the virus, right?
right. And I didn't even think about that. some of the things that we take for granted, to know that there are communities that don't have access to water here in the United States. And clean water it's sobering.
Right.
Wow. But I
Mhm.
also want to talk a little bit because I'm a healthcare provider and I love data. And when we talk about public health issues, there are a lot of pandemics that have happened historically, right?
Yep.
So when we talk about malaria in 2018, 228 million people were infected by malaria.
Still. Mm.
405,000 people have died, mostly in sub-Saharan Africa. And the World Health Organization said it's one of the biggest healthcare crises that we're facing globally. So we're right now in a COVID pandemic. And also the Spanish flu, which infected close to 77 million people back between 1918 to 1920. Also, no, sorry, 500 million people. It was thought that estimated that it possibly people succumbed to death. That number ranges from 50 to 100 million, okay, from 1918 to
Wow.
1920.
You
And
said
COVID,
50 to 100 million people?
yes, it was estimated, yes, died from the Spanish flu, which is the H1N1 virus, influenza A. So my purpose of this was saying to contextualize this, and that's why I want you as an expert. Historically, our ancestors have been battling lots of pandemics.
Hmm.
How does that relate to what we're dealing with right now with COVID?
Hmm. Yeah, I mean, I like that you're talking about the long history of them. And then we just had a conversation about um, historical kinds of injustices and inequities. So if we want to think about how even America came to be, we got to go back to 1492, right? And it's reported across a lot of historical sources that when Columbus and his crew of the Spanish came to what is now known as the Bahamas and the Caribbean, right? The Taino people were there, and they were about 8 million, right?
Mm-hmm.
In that portion of the Caribbean, right? And so by the time um, we had gotten to 1528 about, so this is not even 30 years, because of smallpox, because of certain kinds of influenza that were coming from Europe, right, and certain viruses, that population of Taino people was decimated to 500, Nina.
Mm.
You're talking about 8 million to 500, right? So literally indigenous people have had this experience of having certain kinds of viruses and diseases brought over, right? And then have not necessarily had the immune systems to deal with them, but have also had colonizers and conquistadors like literally trying to infect them, right? So this kind of germ warfare has been with us for what, over 500 years, right? At this point. And so there is a longer way to contextualize this. We have to think about colonization, slavery, right? As the kind of vectors that actually infuse communities with diseases. So if we continue to, I guess this is not a political show, but this stimulus package that's on the table, right? And people's ability to be able to, one, stay in their homes, not get evicted, not put themselves at risk, and do all kinds of work under the table, right? Which could include doing haircuts, right? Working at restaurants that open up when they shouldn't, right? Doing things like sex work, right, will make people more susceptible to the virus, right, and increase numbers of those who are infected. So one, making sure that people don't get evicted, making sure that we actually put money into unemployment, right, and don't just give people $600, right, after what, 9 months they got 1,200, right, and then we're getting 600. It's impossible for anybody to live. Anybody, a one person household, that's impossible, right? So actually, people who are struggling financially and economically are going to have to take risks that then make them susceptible to getting the virus, right? So if we want to keep our numbers down, we've got to address these longer systemic issues, right? So these things about economic justice, social justice are linked to people's health, right? And so these things that we don't see as connected, who owns property, who can be a landlord, right? Who owns the land, that goes back 500 years, right? And so the people that we're seeing getting sick are the people who were enslaved, right? The people whose land was taken are the people who continue to suffer from these pandemics, right? Whether it be the smallpox in the 1500s to coronavirus now, right?
And they tend to be the most marginalized communities. And I never really thought about it like that. And I thank you for bringing that to our attention here on the show, that when you don't have the economic means to support your family, then you go underground and do a lot of types of work that maybe would increase your risk of being infected with the COVID virus. So that is definitely going to impact someone's health
Yeah.
indirectly.
Yeah, your kids got to eat. So you have to work some way.
Exactly.
Mm-hmm.
So, Dr. King, I thank you so much, and we want to try to wind down, but I have some tough questions for you. So, when we talk about building communities to improve our overall health and wellness, what does that mean to you?
Hmm. On a very small scale, some of us have the time now to like check in, right? So, for instance, I had this conversation with some of my students in April, and the question was, how are you surviving the pandemic? And so people were starting to take an inventory, right? Just at the household level, who had poor communication skills, who was dealing with trauma that they hadn't addressed, right? So people were able to have some serious conversations about people's mental health in their household. People are started to have serious conversations about people's own health because they were thinking about, okay, well, if you go outside and do this, how are you going to then impact the family, right? And so people were able to then think about, well, what do I need to take care of myself physically, right? So people are monitoring people's eating. People are taking certain herbs to stimulate their immune systems, right? So just at a household level, even though we are facing a pandemic, you said at the beginning, we are collectively adapting to a new way of life, which is more oriented around health. I mean, I know for some people we're in a state of kind of panic and urgency, so it's been forced upon people, but people have to think about their health and be very intentional on an everyday basis in a way that we were not perhaps 9 months ago, right? But people's health is at the forefront of their mind every day since we're in a pandemic. So, like, literally every interaction that we have to have now is in some way mediated by, have you gotten tested for coronavirus? Who are you living with? When I show up, this is going to be the protocol. We're going to wear masks. We're not going to go to this restaurant. We're only going to be outside. So I think we're kind of hyper vigilant right now and can actually take a lot of lessons for how we have to check in with ourselves and other people that I think is going to really actually help us at the other end of this, right? Even after the vaccine is out and circulating and we have this under control, we'll probably have been using some new muscles like around attending to our health that we haven't thought about before. And so if you so like for instance, another organization that I mentioned, Southerners on New Ground Song, has been doing some workshops on mutual aid, right? Which is something that we've been hearing about more and more, at least in my circles I have been. And a lot of people who were a part of disability justice communities had to figure out how to do this, right? Because a lot of spaces aren't accessible for them. So they build their own networks or pods of people who are going to take them to their doctor's appointments, right? Who are going to drive them, particularly people who are immunocompromised, have been doing what we've been doing forever. So the fact that we're on Zoom, that's the primary way that I know some people, for instance, this scholar, her name is Leah Lakshmi Papenza Sammarasina, and she wrote this book called Care Work about the disability justice movement, which is primarily made up of people of color with disabilities. And she's talked about being immunocompromised and having to navigate for most of her life in the way that we navigate now. So wearing a mask is not new to her, right? Thinking about ventilation is not new to her. Thinking about how many people are going to be in there is not new to her, right? Opting to do a meeting via Zoom instead of face to face is not new to her. But some of these practices are now being incorporated into the everyday protocols of people at Southerners on New Ground or SNAPCO or Sister Song, and are really going to change the way that they kind of operate, thinking about people who are disabled and making spaces more accessible, making them cleaner, right? Doing different stuff around food handling, not making assumptions around what people can eat, right? So I think this kind of work is going to continue on all scales. It's going to continue within families, it's going to continue within organizations. So mutual aid is a thing. Getting to know your neighbors has been important, right? People were wilding out at the beginning of the pandemic, right? Buying up toilet paper, right? And if you can't get
I
some,
did that too.
yeah, and
Corporate.
if you can't get some,
I had cleaning supplies.
but also, what if you didn't get to the supermarket as quickly, right? What if you couldn't? Then you're gonna have to know your neighbor, at least know how to ask and develop a relationship with them. So we're also able to build community in different ways during these moments of crisis, right? That'll teach us how to be with one another and work with one another in different ways, right? So if you can't get it at the grocery store, where are you going to get it? You have to ask and build community, right?
Yeah, and I don't think too that for me, I've had to ask, and
Mm-hmm.
was able to get donations, PPE supplies from the We Love You Foundation. I asked my
Mm-hmm.
clients to sew masks when we
Yep.
weren't able as a small business, because all of the supplies, the PPE supplies, initially went to the hospitals. But as
Mm-hmm.
an essential worker, I'm on the front lines providing care, screening for COVID, treating patients with COVID, and even with my clients who have sickle cell, I'm trying to keep them out of the ER. So I had to provide virtual technology tools to
Yeah.
all of them, so to keep them well and safe at home and to try to manage a routine crisis at home. So I
Mm-hmm.
had to ask my clients and my colleagues for help, which I've never had to do. But I found that when you ask, a lot of times you will get what you
Yep.
ask for.
Yep. No, absolutely. That reminds me of a story that this scholar, Bettina Love, who's at the University of Georgia, and she's an educator, right? And so she was on a Haymarket series talking about how we can make asks for things and expect things that old systems told us were impossible. So she was talking about the Atlanta public school system, where they had been for years trying to get a laptop in the hands of all students, right? Particularly students coming from families who couldn't afford it. Pandemic, it's automatically, right? We have to, because we have to find a way, since we're not face to face, to deliver this education as a product to you. So of course you can have a laptop. And she's like, if it's possible now, it was possible then, because the money didn't change. We're dealing with the same money, but the mindset had to change, right? Exactly. So it's a lot of these things that we thought were impossible or we said no to that we're saying yes to now, and will help us rethink our value system, So lessons.
Well, just wanted to close up. This has been very empowering for me, and I'm so humbled by the great work that you have done. And I've learned so much in this short period of time. We have to have you back again. But I also want to end on a good note. And this is another statistic that I found, that people are actually catching on to the importance of having a sense of community, actually having a care team as a healthcare provider, because we can't live in silo and we have to work collectively. But in 2018, did you know, Dr. King, this was a national survey of health attitudes, which included a sense of community index. It found that 11% of adults reported a strong sense of membership in their communities, which is up from 8% in 2015. And I would assume that in 2020, it increased again. Can you discuss why you think that having a strong sense of membership in a community is important, and that people realize that that is important to living a good quality of life?
Well, first of all, the statistics you shared with me are startling. I didn't know it was that low, like only 8%, and then
Yeah,
it went up to
it's
11.
going up slowly.
Yeah, that's kind of shocking and a little bit
Mm.
depressing to me. Um,
I glimmer for hope for anything.
yeah, no, but I mean, the fact that there's been an increase in people who think it's important is important. But I think you're right. Like during this pandemic, people are going to understand that you can't survive by yourself. You can't just hunker in as a person of one or a team of one, or even just as a closed-in family and not have other networks, right, to support you. That's just not how stuff happens, right? And it's not how all kinds of systems break down, and you don't have all the tools or all the resources to provide what you need. So I need that number to
It should be
increase more than
90%.
tenfold. Right. But I didn't know that statistic. But people shouldn't think of our current circumstances preventing them from connecting. You know, just in the ways that we're talking right now, a lot of communities have had to do, right? And so I'll big up somebody who's right here. You know her, Tina Riley, for instance,
Mm-hmm.
who started it's an art-based program,
Mm-hmm.
right?
Mm-hmm.
So she's doing a vision board session on December 31st. You might be able to interview her actually. So she actually works on connecting people through art and is doing that virtually right now, but did that as an advocate for disabled people who are looking for housing. So she's also part of the disability justice movement and has been connecting with people who've had issues with mobility for years through Zoom, through Skype. Well, actually, Skype before Zoom blew up, right? And
Mm-hmm.
has been doing this kind of community building virtually for years, right? And so has been able to build an incredible network of people, right? Who are part of faith communities, who are part of housing justice communities, who are part of disability justice communities, who are part of art communities, and find a way, right? And so people know the power of this, and people got to plug in. And I think some people are getting hip to that now, right? Understanding that they cannot live in isolation like this, right? And won't return to that kind of living after this experience.
Yeah. Thank you so much, Dr. King. And you did mention the organizations that are doing the work that we talked about today: Sister Song, Southerners on the Ground, Solutions Not Punishment Collective. And our community can look up these organizations, and definitely if you want to contribute or donate, I definitely strongly suggest that. But I also put down TOVA Community Health because, Dr. King, you have really, really helped me as the founder of TOVA Community Health grow, and you understand the importance of the work for taking care of the individuals with complex chronic conditions like sickle cell anemia. So I really want to thank you for your contribution to TOVA Community Health. And it's just nice to see we've grown up together, great friends, grew up in Wilmington, and we both are forging our paths in different ways, but we're also sort of like community activists and community advocates for different issues of social justice. So I really want to thank you for coming on the show today. I also want to tell the community that this book, The Black Shoals, is something that may be for your as a holiday gift, as well as just a gift for your children. It's an important book that they should read and understand historically what has been going on in Black American Indigenous communities, the collective work of trying to fight the injustices that we have been experiencing since the 15th century. Dr. King has really eloquently shared her historical perspective on that. But I also want to end, and I read your book, and it was just very empowering to me. But this particular statement in the book really stands out, and I think I want to close with it. but I want you to talk about it too. You said, just as Black and Indigenous life, struggle, joy are forged off the shoreline in the space of the shoal, so must the new worlds we desire and make for one another. Dr. King, I would like you to end TOVA Tuesday and talk about that.
Well, I'll end TOVA Tuesday with talking about your creativity, Dr. Nina. And that's what I was trying to get at, right? That people who often face death or denied opportunities, we'll put it in that kind of vein and tenor, have to be creative, right? Have to come up with creative and alternative solutions, right? So you rethinking what care and health looks like for people who suffer from sickle cell, understanding it has to be a collective approach. And you used a care team, right? That ties so well into the kinds of work that people are doing in Indigenous communities and in Black communities that are focusing on abolition. They're saying, instead of, for instance, calling in the police, let's get our pod together and think about the skills that we have, right? Who has some counseling skills? Who's a pastor? Who does Reiki? Who does yoga? Who knows how to calm people down? Who's an MSW? And when we have issues, we bring in those people. We have skills and resources that we've had to use to survive, and we need to learn how to take an inventory of them and call them in. And that's a holistic approach, right? And that's something that you and your board and the people that are part of this TOVA collective do. We need a holistic approach, right? To healing the body, healing the mind, healing the spirit. So I think that statement was about that kind of creativity, right? And relying on resources that we know that are there and having the courage to cultivate them and share them with one another. So that was the spirit of it.
Thank you, Dr. King. Thank you for such an empowering TOVA Tuesday today. And I would like to ask, how can people get in touch with you?
Certainly you can use the email that you see on Dr. Nina's screen, tking37@gsu.edu if you want to contact me. My Twitter is unreliable. I'm not yet on the Instagram the way that I should be. But if you get me at that email, you'll get a response.
Okay. Well, thank you, Dr. King, for coming on TOVA Tuesday. Remind you, if you like more of these episodes, please visit our website at www.tovacommunityhealth.org. You can also like us on Facebook or Instagram, or you can email us at contact@tovacommunity.org, or you can go to our TOVA Health YouTube page as well and view all of these episodes today. Dr. King, it has been wonderful, and I look forward to seeing you again. And I've learned so much. And again, just as the shoal, it's a place, a common ground that we all have to be able to navigate in these tough waters of uncertainty and work as a collective, as a school of fish, a shoal, a school of fish. But we also need a team of healthcare providers. We need a care team to help us live a quality life. And I thank you for sharing all of the great work that your organizations that you support, as well as the work, your literary work. And I hope and pray that you can continue to write and to share your knowledge with others and empower the next generation of leaders. Thank you, Dr. King. You have a great day.